Ocala's information station, 1370 WOCA. Ocala.
All right, 6 minutes after 11 o'clock. Thank you for tuning in. We were talking about golf a little while ago. And did you know that many, probably maybe even all of the professional golfers that you are familiar with their names as household names like Tiger Woods, etc., that they actually have on their staff a chiropractor? Did you know that, Robin?
Oh, yes, I did. I think I did, yes.
And so it's interesting because the everyday person, when you say, have you ever gone to a chiropractor, they'll say, well, yes, I did. I had an accident one time, and I went to the chiropractor to help me get back in shape. And then you think, well, wait a minute. Why these professional guys have them every single day doing something with them, right? And I think we had a conversation with the baseball guy. I think they also have them on staff.
Yeah.
So we're gonna find out right now, because I think, if I'm right, we have a chiropractor in the room. Am I right?
Yes, you do.
He's a young, handsome one too, Robin.
Yes, he is.
I know.
He's hot.
I know. I'm not even in the room right now. I know. I can tell. I can see the. I'm just teasing. Dr. Andrew Kluger is here. Do I have your name right?
Yes, sir. That's
Thank you,
correct.
Doctor. You are a chiropractic doctor for Strive Physical Therapy Centers. Leah Caruso at the other end of the table. Good morning, Leah. How you doing?
Morning, very well, thank you.
I think I make your put your microphone on. I'll be able to hear you. And Leah is introducing us to Dr. Kluger. We're going to talk about the art of chiropractic and the science of chiropractic. Good morning, Dr. Kluger, again.
Good morning. Good morning.
Officially, say good morning. Wow, and I hope I'm not saying the wrong thing, but you're so young.
Well, yeah, I credit that to my mother. She's a young woman as well, and I got good genes passed down to me. I'm actually 30 years old, so.
You
Wow.
are? Okay,
Yeah.
wow.
Yeah.
Yeah, you don't look 30.
Well, thank you.
No.
Okay. So, what I just said, does that resonate with you? Do you find that to be true that some professionals, especially in sports, have chiropractors with them every day? And maybe you can help me understand what they do. But many of the rest of us only show up at your office when we've been injured.
Sure. Yeah. I think that athletes are really attuned with their body. I mean, they've got especially Tiger Woods. These guys are super strong athletes, and they're really in tune with their body to know where they are feeling some restriction or where they might have they're lacking in certain places. So yes, a lot of athletes do go see chiropractors.
So expand on the lacking in they're restricted somehow. Their bodies are restricted. Could I visit you and you point out to me, you're probably restricted somewhere because you got this going on here? Would I relate to that?
Yes, I believe so. When you talk about athletes like Tiger Woods, they've got a backswing and a foreswing in their golf stroke, as well as in baseball, the same thing. Now, you every day are sitting in your chairs and you're typing at your computers, and you may feel that you're slunched over in your chair. And you feel that there is some restriction there when you sit
so
back
self-conscious
up,
now, Lee. I'm so
know.
self-conscious.
So yeah, there is something that we find. You may or may not notice it sometimes, but there's that one odd chance here or there that you're doing something, putting the groceries up or putting something into the cabinet,
right.
And you find, wow, I'm a little bit limited there in my reach, or not sitting back in your chair with your shoulders back. Posture too.
There's the regular visits to a chiropractor, and I'm going to ask you from the professional golfer, professional athlete,
right,
to the guy putting up groceries in his home. On a regular basis, the professional athlete is having chiropractic treatment, maybe every day, a massage or something like that?
Well, it's really all depends. These guys are getting out there playing their hardest, and they may or may not feel that they need it the next day after a sporting event. But I'd say that your average athlete goes in once every 2 weeks maybe. But more regularly if needed. I mean, they're, like I said, they're in tune with their body. They know whether they need it or not a lot of times. So they feel that their backswing isn't in the right place. So
when you're working to rehabilitate somebody who's been injured, is the patient who has been the regular visitor to a chiropractor easier to rehabilitate than the person who's never been?
The regular patient would be easier to see and to get back on track. Now, that's because the person who's never been to a chiropractor before may have had this problem for an extended period of time. They may have had it for months, if not years.
Oh, okay.
And so you find that those guys are the ones that take a little bit longer to get back to where they need to be.
So the car accident may just be the catalyst that got them to you. Maybe even made something that was wrong even worse.
Sure. And like I said, they may have had it before, and like you said, the catalyst kind of flares it up, and they notice it even more at that point.
Right.
Is a chiropractor a physical therapist?
They are not physical therapists. I work at Strive, and we're working alongside physical therapists. We've got similar backgrounds in our education, but they have their focus and we have our focus, and we try to come together and work with every patient that needs it.
So now, in our best interest, we go to the dentist every 6 months. We go for our regular checkup with the doctor at least once a year. Even our attorneys, we're supposed to go to see them every year to make sure that our wills are in order and all that stuff, right?
Right.
Do you see that same trend happening with chiropractors? Are people scheduling your services every 6 months or every regularly, whatever the time period is?
Sure. A lot of times, once you are to where we would think that you're basically out of pain, or you feel as though you don't need our services any longer, patients will schedule it out, a month or even 2 months. But that's our goal at Strive Physical Therapy, is to get you to a point where
right.
you don't necessarily need to come on a regular basis. A regular basis is in every week, multiple times a week. But once you get past that stage of being in pain, you come in once a month and get tune up, so to speak, because like I said, you become in tune with your body, and there's something not quite right.
Can you tell if a person is having a deformity happen in their body? Sometimes we see people that have those humps on their back, and if you see that early enough, can you catch it and not have that happen?
Well, there are lots of studies out there that show deformities such as that, even scoliosis, that chiropractic may be beneficial to it. I can't say whether it would be whether it would prevent future changes, future exacerbation of that hump on the back or the scoliosis, but it couldn't hurt.
Do you go to the different schools and give the lectures about the proper carrying of backpacks and how much weight should be in there, things like that?
That's the biggest problem I think we see, is that there's poor education for students who are either hunched over their desk and doing their homework, or the backpacks, proper posture, doing everyday things. Right. There's just, we should be doing things correctly. Everybody knows, everybody's mother, father told them, hey, you need to sit up straight, you need to keep your shoulders back, all that stuff. It's a problem. So yeah, we probably could do a little bit more education. It would be helpful.
Let me ask you about being part of a team. You're at the Strive.
Right.
You're at Strive, and I know that's a team. There are other professionals there as well, other therapists. Does that make your work as a chiropractor easier? In other words, do you sometimes see something and you say, "Oh, you know what? Go down the hall to Dr. Such and Such," or maybe they do the same thing in reverse to you. They send somebody to you. Does being part of a team where there are more than one specialty under the same roof help you?
Yes, we have extensive education. All of our physical therapists are doctored of physical therapy, and we do collaborate. We see a patient, we evaluate them, we see where they're deficient, where they might have some restrictions, where they might have some problems with their muscles, and we sit down and we talk about it, and we, especially if it's something that we haven't dealt with a lot, there's some strange things that come in, and you find that, hey, it would be good to sit down and talk with your colleagues, your team, and figure out, plan of action for them, because everybody has a customized treatment plan.
Does this might borderline on a political question, and it's not my intent though, but I'm just curious, does the new Healthcare Act enable people to more likely show up for your services, or is there even any connection at all with the new rules or with the new laws?
The new laws, as far as I know, have incorporated some services like chiropractic that if you weren't previously getting it, you could check to see if you are receiving it now. You know, everybody's health insurance plan is different, it seems like.
Right.
So, I mean, if you're keeping your old one, it may have stayed the same, it may be different. You know, it's just really something to check up on with your insurance provider.
Now, how do you help people that have just gotten a hip replacement? How do you help them? Can they still come in for chiropractic services if they've been seeing you before they had to have that hip replaced?
Yes. You know, chiropractic care is not only the low back, but the neck. You find that there are problems in the upper body if you've had surgery or problems or injuries in the lower body. It's kind of one big chain, and something down low in the hip, for example, could affect your shoulders, could affect the muscles up top there. Okay. So, but for the most part, if you are fresh out of surgery, we're very cautious about what we can do as far as chiropractors. Physical therapists, on the other hand, are working with people who've come out of surgery from hip replacements or the like every day. I mean, that's something that we really, really want to see you in, coming on a regular basis and getting you back to where you were before you had the surgery.
Dr. Andrew Kluger is who you're listening to, and I want to invite you as listeners to call if you have a question for Dr. Kluger. He is a chiropractic doctor for Strive Physical Therapy Centers, and Leah Caruso in the studio brought Dr. Kluger to us. And as you probably already know out there, Strive is what we call a clinic, a therapy center that has many different specialties under one roof. Do you want to fill in some of those blanks, Leah? I'll turn the camera on you. Where are you? Go ahead.
Well, at Strive, we have physical and occupational therapy. We have 4 outpatient locations. Yes, we specialize in sports and orthopedics, industrial care. The new program with Dr. Kluger is our spine care program. Dr. Kluger, should I talk a little more about that?
Sure.
Okay, thank you, Leah. Sorry, I mean to throw you a curve right there. Do you want to elaborate on what she said?
Well, our as you mentioned earlier, the team. I mean, we are one big team at Strive, and you know, we collaborate with the physical therapists as chiropractors, and we're using multiple techniques. We're using multiple, you know, the latest technology with adjusting instruments. With techniques, we're trying to stay ahead of the curve on providing the best care we can.
Right. Did you see the story this morning? There was a Chinese lady had 9 inches added to one of her legs.
I did not see that.
Oh,
wow.
Man. And I don't know what they did, because I only read the headline. You know, Chinese woman gets 9 inches added to a leg. Mm-hmm. I hope it wasn't the Inquirer website. I'm not sure. But I thought, wow, that's amazing. I'm guessing they used some kind of a cadaver bone. I don't know how they would.
I have no idea.
I have no idea how they would. All right.
When Aaliyah mentioned spine care program, is there something that people should be doing every day?
Well, as far as spine care goes, what we're trying to do is, again, incorporate the physical therapy side of things. So proper sitting techniques, proper lifting techniques, and on top of that, we're trying to inform the patient that, you know, exercise is important, core stability, the back muscles, shoulder muscles. You know, we want to do all of these things to all these exercises to stabilize the spine.
And that's really evident on women that are pregnant, because all of a sudden they've got this weight in a place they normally don't have it. So how can you rest them at ease that once the baby's delivered, their spine will be okay?
Sure. I think that the biggest thing we can tell patients is, you know, I know no one plans a pregnancy, but some people do plan a pregnancy.
Some people do, yeah.
Right.
Yeah. but no, so hopefully you do plan a pregnancy. But you know, having core stability before the pregnancy, having you know, being a fit, toned person as best as you can be before the pregnancy will help once you've had the baby, and to return back to that state you were before.
Mm-hmm.
So do most of the people who come in for rehabilitation, are they coming in as a result of an accident or the result of some, whether it's I have another question. I'm sorry, I'm going to jump around the board a little bit. Was it like last year or so there was a new rule that changed the amount of time you have to go after a car accident? Was it 2 weeks or something? It was like,
I think it's 15 days.
it was really unbelievable. It's like,
days to get to
sorry,
medical care.
Leah, you said 15 days. Okay. I don't know why your mic wasn't working, but yeah, that seems like a problem. Seems like somebody might. Okay, here's the scenario I picture. I'm in because I've been in an accident. Knock on wood, I'm never in another one. And who knows? A month later, I might have said, "Oh gosh, what's that in my neck? I don't remember that before." Go to a doctor. Oh, that's from the accident. Sorry, too late. Can't do anything with you now. Right?
Yeah, and you're finding that you may find that these are delayed symptoms. Right after the accident, you may be just really sore, and you might find a month later.
So can you see that? So let's say somebody comes in and say, you know what, I'm in an accident, I feel fine. The other insurance company called me, and I said I feel fine, which is a mistake according to the attorney we have on Wednesdays. But I'm showing up only because I'm so afraid that a month from now I'm going to find something is wrong. Can you tell me in advance? Well, you do have something that might start acting up. Can you see that?
Yeah, very much so. I mean, not just for the area of complaint, like say you have complaint in your neck and because you had whiplash,
right.
But we're putting our hands all up and down the back, and we're definitely feeling for restrictions. You actually are pushing into the back and feeling the bones move, and that bone will have a restriction. And in that case, you'll know that there's possibly going to be a problem one day. Not to mention we do X-rays to make sure to get an actual picture,
right,
but X-rays aren't necessary all the time. But in the cases of car accidents, X-rays are definitely recommended because there could be more extensive damage.
Now, this might be a lawyer's question, so I apologize, but do you know if the rule says 2 weeks for a car accident, is that true for let's say I fall down the stairs at home? Do I also have 2 weeks there from that? Does anybody know?
No, I think that is.
Oh, that one doesn't.
Specific for a car accident.
How come I don't hear Leah?
That's fine.
I have all the mics up because it's that special microphone over there that
That's
sometimes
right.
gives me trouble.
In your bio, Doctor, you have a interest in the arts, design, and theater. We have wonderful arts groups and theater groups here in our community,
Sure.
and they put on these fantastic productions. But when they go out to try for a production, or they're set builders or things like that, they're only there for a small amount of time, and then they have to learn dance steps or some kind of different movements or swinging hammers and things they normally wouldn't. How do you what do you say to them to enjoy themselves but don't get hurt?
Right. Well, I have actually worked with the theater group at the Civic Center.
You could be an actor.
Yeah.
You've got the actor looks. Doesn't he have the actor looks?
I think so. He's got animated eyes.
They actually asked me to come and try out for the next.
I'm glad Robin said that.
Performance. I don't think I'm going to do it though.
Oh, okay.
But yeah, these guys are. A lot of them are trained dancers. They're trained to be thrown the curveball and be asked to do something that's in the script,
Right,
something that they don't do every day. So yeah, there are different scenarios that these actors are being placed into when they're on stage.
Set design too, because you're lifting
Sure.
lumber and things
Sure,
that's
yeah.
really, really heavy. What do you say to those people?
Just keeping proper posture, when you're lifting certain things. I mean, these sets, the most recent play is black patent leather shoes.
Yeah,
Do they really reflect up?
Yeah.
Yeah, right.
And the set they have there is amazing. It's a beautiful set, and there most likely was a lot of heavy lifting when it came to building that set. So yeah, my recommendation is just to be mindful of everything you're doing, and proper lifting techniques,
Well, you should try out. You get a part.
Oh well, we'll see about that.
There's Camelot's coming up, and
Right, yeah.
and so that would be great.
We'll
Sir
see.
Lancelot.
Yeah.
Robin mentioned Camelot, and the word camel struck me. No, I'm just teasing. No, but she mentioned the hunch on the back.
Right.
So I have a question about nutrition. I was always told that this is more likely to happen for women, and it's more likely to happen for women with a
calcium
deficiency. True? You're not sure?
I really couldn't say. I know that the osteoporotic or people with calcium deficiency, their bones become brittle, and over time they begin to settle. And our natural body, or we're most often slunched forward. And so you're putting that much pressure onto that portion of the vertebra, and because it's basically a box, and you're slunching on the front half of that box, and over time it could settle in the front there. So you end up with a
what do you call it? Dower? What do you call it? Widow's dower? What do you call
Yes.
it? A widow's hump? What do you call it?
Dowager's hump.
Dowager's hump. You need another microphone. I think that one's not working. I have it turned all the way up. I promise you. All right. So what is the process for seeing you? Do I just knock on your door and say, "Hey, I've been in an accident, or I have a crooked neck"?
Right. Well, as chiropractors, I'm in the physical therapy setting at Strive Physical Therapy. As chiropractors, we do oftentimes see people coming off the street. They don't have to have a referral. They can come right in.
Oh, really?
Right. They can come right in, come see us. We'll evaluate them. We'll diagnose them. We'll treat them. Now, in the physical therapy setting, a lot of the patients there are already under the care of a doctor, of an MD,
Right.
and they are being referred to the physical therapist to be treated there.
Do you do sports physicals for the high school students when they go out for the sports?
Yes, we do. We do sports physicals. We do adult physicals, or we do DOT, Department of Transportation physicals for the
Really?
drivers. We do all of that. Yeah.
Oh, okay.
And it's really fun to work with the kids. I mean, these kids are, just like me. At one point, I was getting a physical done before a soccer season in high school or middle school, and so following these kids along in their profession or in their sports is really great.
That's really wonderful to know, because that way, if you see something else that's out of the ordinary, you can tell the parent, and they can make sure to have that particular thing taken care of also.
Right. Yes.
Yeah, I wonder if that is a scoliosis. Is that the curvature of the spine? Is that what it's called?
Yeah.
I wonder if that's going to change now that so many schools are going to textbooks on like an iPad or a Kindle
Yeah.
or something like that. In other words, there's less to carry around now.
Well, we actually don't know what causes scoliosis.
So the assumption that it's a heavy backpack might not even be right.
Right. It may not be. It could be going back to birth, to how the baby's pulled out of the womb, and there could be some trauma to the neck and to the back in that situation.
Oh, really?
It could be a genetic disorder that we just haven't quite found yet. But I can't. I'm speculating. I don't really know.
So
what it is.
chiropractor needs to be there when somebody's born. Hey, you're pulling on the baby wrong.
It can be pretty traumatic.
Could be. I
forceps and
my job is to be
yanking
silly, but I think I may have made a point. I'm not sure.
Yeah. Yeah, because sometimes when babies are delivered, their legs are very, very bowed.
Right. Yeah.
And then do you step in and help get them straight again before they start growing?
Pediatric chiropractic is something that's really fun. I mean, you're getting to see babies, as little time as hours out of the womb. So it seems that it has its benefits, and it's really popular. Yeah.
I've heard from a few people that have said that it looked like surgery was going to be their choice of procedures, and then somebody said, "Why don't you go see a chiropractor first?" And I'm not trying to oversell what your profession does, but I've heard good stories from people who said, "You know what? I didn't even need surgery." Have you experienced that before, where somebody went to you just as an off chance that maybe you could help them avoid surgery?
Sure. Every profession has its place, depending on the extent of the damage or the injury. You'll find that you might be right. You might be suited well for chiropractic care. You might be suited well for cervical or surgery.
Yeah.
So it has its place. We definitely would recommend a non-invasive form of healthcare before going through the surgeries. But at the same time, we have a lot of there's a lot of success with chiropractic care.
Does that include carpal tunnel, the wrist thing?
Now, we are trained in moving almost every bone in the body. At the same time, there are occupational therapists, hand therapists at Strive Physical Therapy that do a lot of that, and that's very helpful. But
for musicians, especially.
For musicians, for pianists.
Wait a minute, the hand therapist is really cute, isn't she? What she is? Right?
You had both of them on. We have 2 hand therapists.
Yes, you've got cute people over where you work, don't you? All right, I see the trend here. Yeah, there's something in the water over there at Strive.
When people are going to become a doctor, I hear that for the first few years you take all the same classes and everything, and then you branch out into the different professions. Why did you become so passionate about chiropractor? Or chiropractic?
Chiropractic, you're right. I had planned my direction from the beginning. I knew that I wanted to go into chiropractic care, and I knew that this is what I really wanted to do once I graduated from college. But you're right, most medical professions will take anatomy, they'll take chemistry, they'll take all these courses that are kind of like from the ground level up. And so I knew where my direction was going. And at a certain point, they do start leaning towards, or each school starts leaning towards what the profession is about. They'll start leaning towards adjusting. They'll get you adjusting and learning about anatomy specifically of the spine early on in your education, and then eventually you take that turn into your profession.
Wow.
Can you really tell the weather with your bones? Every once in a while, yeah. You don't know if it's true.
Well, everybody has. Everybody will say that.
My knee, it's gonna rain. My knee is hurting.
And it is. Look at that. It's pouring.
Well, it's not me. It's happened to be raining. Wow, great interview, Leah Caruso. You always bring us some great guests. Dr. Andrew Kluger, you are one of those great guests. Do you want to give out any information? How do we get a hold of Dr. Kluger or Strive?
Well, you can give us a call, and we'll be.
We have there's always our Strive main number is 352-351-8883, and then to make an appointment specifically with Dr. Kluger, you'd want to call 352-732-0055.
Okay, all right.
And we also have Dr. Pritchard, who works with us at our West Marion location. He's also a chiropractor.
Okay.
So
that's
either
good to
one.
know. Okay, you guys go to lunch together? Is he good looking too? Are you a good?
And what location are you at, Doctor?
I am at the Bellevue office.
Oh, okay.
As well as the Mary Camp office.
Mary Camp location, yes.
Okay.
In Ocala and Bellevue.
If he watches this video, he's going to say, "Why didn't you answer? Why did you laugh? Why did you laugh when Larry asked that question?" Fun interview, very informative interview. Thank you for coming in. Thank you for what you do for all of us, and. Thank you.
Thanks for having me.
And Leah, thank you as always. And thank you, everybody over at Strive.
Thank you.
And try out for the next production. I want to see your name in the playbill.
Robin's there every show. Every show she goes to these theater
Season
things.
tickets.
The theater is fantastic here.
You are too? You're a theater
I love
goer?
it. And I think you're right. They do an absolutely wonderful job with their stages. It's incredible what
You ever bump into each other? You and Robin?
No, I haven't.
No, haven't yet.
Now we will, though.
Yeah.
See, Robin used to sit next to some guy. He used to complain about her perfume.
He made me cry once.
Yeah,
that was bad.
And then what happened to him?
Yeah, he's gone.
He's gone.
Yeah.
The power of a radio broadcaster, huh?
He's gone. He was moved to
I don't know what she
different
did.
two seats.
Gone. Do you go to all the shows?
My first performance was the one I mentioned, the black patent leather shoes.
Dr. Kluger is brand new to Ocala.
Oh, you're new. Where'd you move here from?
I originally moved from North Carolina, but that was about 5 years ago. I moved moved to Florida to go to chiropractic school in Port Orange.
Oh.
And then about a month and a half ago, I moved here to Ocala.
Oh, wow.
Oh, wonderful. You're going to love it here.
Yep.
It's a great town.
Plenty of bones here.
That's right.
That's right.
Plenty of bones. All right, Dr. Kluger and Leah Caruso, thank you both.
Thanks.
Thank you.
We will take a little break. We're going to have fun with Joe in about 10 minutes.
Habitat for Humanity of Marion County is a ministry dedicated to improving lives by providing affordable and decent housing. Help them help others by visiting the Habitat for Humanity Ocala Restore at 926 Northwest 27th Avenue.